Oakland County is actually very lucky. We have a very strong continuum of services. One area that Oakland Family Services fills specifically is we take Medicaid. We take nearly all the Medicaid different HMOs that there are, and many providers can't afford to do that. The biggest issue with mental health is we are underfunded dramatically for one of the most critical services that there is. So, for example, Oakland Family Services can lose anywhere from $40 to $70 per session that we provide, just because we use Medicaid, take Medicaid as a provider, and we don't get reimbursed the actual cost. So we use grants to supplement that because we feel as a safety net provider, taking Medicaid, which you have a huge amount of people, especially with Medicaid expansion on in our area. And as I was saying before, we deal with a population that's high in need, that lives in poverty, or is pulling multiple jobs together and is what we in the industry calls underinsured. They have insurance, but it doesn't cover everything fully, or they can't access it because they can't afford their deductible. So we're using grants to offset that loss in cost and also to help people if they can't afford copays necessarily in a time of this high of need. I will say that while demand has gone up, follow through on engaging in treatment in some situations has gone down, and that is not uncommon. We saw the same thing in 2008 when there was the financial, fallout and the recession. People who have high deductibles or copays, if you think about, Maslow's hierarchy of needs, are you worrying about your food and paying your bills versus a deductible for a therapy session or a copay? You might see that as an extravagance when we see it as basic needs, right? We consider mental health treatment a basic need, a basic health need at this point. So we're really working to encourage people when they reach out to engage in those sessions. Typically, once people start, they keep coming. So we've seen those demands, and we're working hard to be sure that our therapists are, have a bunch of different times that we're available. So we do early sessions in the morning, we do later sessions in the evening for those people who are not unemployed and are currently working and working to maintain that employment. We're working hard with moms who have kids home virtually. And don't know what to do and how to fit in their session. One of the struggles virtually is people feeling like they have confidentiality in their own home. So our therapists, we've done a lot of offering resources and training around helping people switch that mindset and modality. If you're getting treatment someplace else, what does that look like so that people will still engage? And making a lot of resources available and normalizing people's stress level. A lot of our clients engaged before the pandemic because they had other mental health issues going on. And so now all of this on top of that is really making these times even more stressful. So offering the opportunities to schedule and engage when it works for people most, ensuring that we have a wide swath of availability. And for our therapists, my therapists are all working remotely. So it kind of takes the those regional boundaries down. So my therapists have typically worked at different locations, and that doesn't matter anymore. We can increase our availability because people can serve anybody anywhere. And so that's really where we're aiming for.